relax, lay down. Or like, yeah. Okay, so this is going to be abdomen and thorax evaluation for competencies semester C. I'll start with checking for ABCs, airway, breathing, and circulation. Then for history, I'll take a past and present history. Asking or checking for unusual sounds for pneumothorax, for crepitus, or if there's any crepitus or sucking, and as well as unusual sensations for breathing or nerve problems. Then I will inspect for any swelling, discoloration, deformity, abnormal breathing patterns, pneumothorax or shock, deviated trachea for pneumothorax, hemotysis or hematuria. I will also inspect the breast for any contusion, or if it's a female, I can ask, is there any contusion, bruising going on, and as well as the nipples for any heat rash. And then I will begin with palpations, bony palpations for, these are all for fractures or luxations. I guess I should grab the camera for this one. Oh, you can't flip it when it's, okay, let's see. So, are you able? No. All right, they can see you, right? So I'll palpate the clavicle, the shaft, the SC joint and AC joint, sternoclavicular and acromioclavicular joint for any fracture, sprain, luxation, the sternum, manubrium, and the body and xiphoid process for any fractures, the ribs, the body of the ribs, the costochondral joints and costosternal joints for any fractures and luxations. Then I will palpate the, you're actually gonna have to lay on your stomach really quick for this one. The thoracic vertebrae. Let's see what else. Thoracic vertebrae. The costovertebral joints for any luxation. Then I'll soft tissue palpation. So turn back around. Sorry. All right. You have to tell me if the camera is able to see you. Okay. And then so I'll palpate. Well, in this case I'll pretend, but pec major, the pectoralis major, intercostal muscles in the ribs, the rectus abdominis, and then the internal and external obliques as well. And the abdominal quadrant, so your upper left, lower left, upper right, lower right. For rigidity from contusion or organ injuries, internal organ injuries, and as well as the breast for any contusions. Next will be special tests, so abdominal rebound pain test for any internal organ damage. I'll push, and then if I let go and there's pain during the rebound, that means that's an indicator for a positive test, meaning there could be internal organ damage. Rib compression test. I'm holding the camera with one of my arms, but usually I'd compress both sides. You know, if there's pain there, then that's positive. Forced inhalation for any external intercostal strain. So you're actually gonna inhale as much as you can, like until you can't anymore. If there's pain there, that's positive. And then forced expiration, breathe out until you can't breathe out anymore. Nice. That's for internal intercostal strains. Then Kerr sign, a spleen. For this, they could have a spleen injury, but complain of like pain in the shoulder. And lastly, the McBurney's point appendicitis. Just squeeze where the appendix is. And then so range of motion, I will test it actively and pass. Okay, I think I can actually put this down. Okay, so stand up, and then you're gonna copy me. So you're gonna do trunk for range of motion. I'll test it actively and passively. In this case, I'll have her do it actively. We're gonna do trunk flexion, so you're gonna go like this. And then trunk extension. Yeah, Nice. You didn't have to do that. Just do this. Yeah, nice. As well as rotation. So like, yep. And then lateral flexion like this. Nice. And then for muscle strength tests, you can lay back down. Like, yeah. So we'll start with a trunk rotation. If you can kind of do a sit up, you're gonna go this way, rotate. And then same thing with the other way, go. Nice. That's for the rectus abdominis, internal and external obliques. Then for trunk flexion, it's going to be for the rectus abdominis as well as the internal and external obliques and transverse abdominis. So you're actually just going to go straight up instead of turning. Okay, go. Go, 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 go. Nice. And then trunk extension for the rectus spinae, I would have her, you don't have to, I'd have her turn over and then just press against her and she'd go into thoracic extension basically. Then it's called lateral flexion. We'll just demonstrate one side. So go on this side. So you're facing the camera. And then like kind of like hold yourself. And then so she would hold herself and then you'd actually go against me this way. Nice. And that's for lateral flexion for the ipsilateral flexors, extensors, ipsilateral quadratus lumborum, and the intercostals and diaphragm. So next is neurological. Motor would be beaver sign and lay flat. I would inspect her belly button and have her do like a crunch. If the umbilicus moves up, that's an indicator of a positive test. Then sensory would be, I guess I'll just, so sensory, I'm not actually going to touch you, but I'm just going to tell her what I would touch. I do T1, which is at the armpit, T2 to T3, which is between T1 and T4, and T4 is at the nipple line. T4 is at the nipple line. And then T5 is between T4 and 6, and T6 is going to be the xiphoid process. And then T7 to T9 is obviously between T6 and T10, and T10 is the navel. T11 is between T10 and T12, and T12 marks the is at the pubis, which is above the inguinal ligament. And then I would end with a blood flow test, just blood pressure, and I would compare bilaterally.